Hello, and thank you to the National Newspaper Publishers Association for inviting me to join you today. I'm Dr. Leandris Liburd, the Chief Health Equity Officer for CDC's COVID-19 response and the Director of CDC's Office of Minority Health and Health Equity. Today, I will help to set the stage for what we know about who is placed at risk for COVID-19 and how CDC is responding to health disparities during the COVID-19 pandemic. CDC is working hard to address increasing COVID-19 health disparities. The population health impact of COVID-19 has exposed decades, if not centuries, of inequities that have undermined the physical, social, material, and emotional health of racial and ethnic minority populations and other population groups that are bearing a disproportionate burden of COVID-19. To accelerate progress toward reducing COVID-19 disparities, CDC established the Chief Health Equity Officer Unit in the COVID-19 incident management structure. This unit's sole focus is to ensure an all-of-response approach to identifying and addressing health disparities. This is the first time in the agency's history that a senior leader was placed on the incident management leadership team with the sole focus of ensuring an all-of-response approach to identifying and addressing health disparities. Long-standing systemic health and social inequities have put many people from racial and ethnic minority groups at increased risk of getting sick and dying from COVID-19. There is increasing evidence that some racial and ethnic minority groups, particularly Black or African American, Hispanic or Latino, and American Indian or Alaska Native people, are being disproportionately affected by COVID-19. Inequities in the social determinants of health, such as poverty and healthcare access, affecting these groups are interrelated and influence a wide range of health and quality of life outcomes and risks. Population-wide public health strategies need a complement of culturally and linguistically responsive and comprehensive interventions tailored to address the unique circumstances of groups at high risk of COVID-19 to effectively reduce disparities. CDC's guiding principles are to reduce health disparities, to use data-driven approaches, to foster meaningful engagement with community institutions and diverse leaders, to lead culturally responsive outreach programs, and to reduce stigma, including stigma associated with race and ethnicity. In the coming months, we will strive to expand the evidence base to increase our understanding of the impact and the factors that led to the disproportionate burden of COVID-19 on racial and ethnic minority populations. We will expand testing, contact tracing, isolation options, and care to reach populations that have been put at increased risk. We will expand program and practice activities to support essential and frontline workers to prevent transmission of COVID-19. And we will increase an inclusive workforce equipped to assess and address the unique needs of an increasingly diverse U.S. population. We all have a part in helping to prevent the spread of COVID-19 and promoting fair access to health. To do this, we have to work together to ensure that people have resources to maintain and manage their physical and mental health, including having easy access to information, affordable testing, and medical care. We need programs and practices that fit the community's conditions, where people live, learn, work, play, and worship. These are also called the social determinants of health, and they affect a wide range of health and quality of life risks and outcomes. A longer list of actions can be found on CDC's COVID-19 webpage for health equity under What We Can Do. I encourage you to learn more about CDC's Chief Health Equity Officer's Unit, Health Equity, and the COVID-19 Health Equity Strategy by visiting our webpage. As I close, CDC continues to facilitate partnerships between public health practitioners, state and local health departments, public health agencies, scientific researchers, professional organizations like yours, and community organizations to share information and collaborate to prevent COVID-19 in communities placed at higher risk. We are grateful for all that you do for our communities and your interest in drawing attention to our work as we move the nation forward to reduce COVID-19 disparities and achieve greater health equity. Thank you.